that as a society, we're all practicing social distancing and doing everything we can to slow the spread of this virus. We must do everything possible to avoid a situation where we see a sudden and dramatic spike in the number of cases, and as a result, add to the already significant burden on our healthcare system. As the Government of Ontario, we're taking important steps to flatten the curve. That's why earlier this week, we declared a state of emergency and enacted special powers to limit public gatherings, and at the same time, we're investing to build further capacity in our healthcare system. Employers, employees, businesses, and politicians, we all need to do our part to look out for each other and stop COVID-19. That's what I heard this morning on a call with the Retail Council of Canada and CEOs from Ontario's retail chains, including grocery, hardware, and pharmacy. I heard today that their #1 concern is the health and well-being of their employees and the public. They're taking important steps to help, like reducing store hours, stepping up cleaning in stores, and adding sick leave and guidance for employees. We talked to them about options to help practice social distancing in stores, such as offering more pickup options for customers. One of the things I heard on the call today is they need more flexibility with deliveries from the warehouses so they can restock their shelves. Right now, municipal noise bylaws prevent them from accepting deliveries at certain hours. So we're going to bring temporary changes to allow them to accept deliveries 24 hours a day, 7 days a week, so people can continue to get the essentials they need. And what I heard was, despite some pressure on the system due to panic buying or the supply chains in Ontario and Canada remain strong. So I'm asking people once again, be patient and do your part to take pressure off our supply chains. Please don't hoard and don't panic buy. If we all do our part, there should be plenty of supply for everyone. I want to take a moment to recognize and thank the incredible employees throughout the supply chains that we're counting on right now. From the farmer producing food, to the trucker delivering supplies to your local store, to people stocking the shelves, and especially those working at the cash registers. These people are working hard and doing their part for Ontario. Please thank them every chance you get. If you're in a retail store, walk by and thank them. And we will have to do our part. As I said earlier this week, we're looking at every possible way to help those workers and families impacted by reduced business hours or closures. We don't want you to worry about your job. We also don't want you to worry about how you're going to make rent this month. That's why I've directed that all eviction orders be suspended until further notice. We want to make sure you and your family can stay in your home during this difficult time so you can put your health and the health of others first. Lastly, we're suspending all renewals for driver's licenses, license plate stickers, and health cards. It's just one less thing to worry about. And in the coming days and weeks, we're going to keep providing relief to families and support the employers. My friends, we need to pull together as Ontario right now. We need to take the lead. We need to beat this virus. And if we listen to the experts, if we practice social distancing, if we stay the course and stay together, we will get through this. I thank you, and God bless.
Okay, we'll take questions from the floor first. Let's alternate between Mike, if you want to go first.
Hi, it's a question for the Health Minister, I believe, Premier. Minister Elliott, a group of researchers, clinicians at University Hospital Network, Sunnybrook Hospital, and the University of Toronto have posted an analysis that they say even in a conservative scenario that sees a growth rate of infections of 7.5% per day, that Ontario would run out of ICU beds in about 37 days and would run out of ward beds in about 7 weeks. What do you say to that?
I would say that we are building capacity. We don't know exactly what's going to happen, but we do know that the pressures on our healthcare system are going to increase. We are looking at increasing bed capacity with the announcement that was made by the Premier the other day with respect to additional resources coming to us. We will be able to increase the number of beds in the areas where we most need them. We're also looking at other alternative measures where we can perhaps place some people who are alternate level of care that are currently in our hospitals to a setting that is going to be safe for them and appropriate for them. So we are doing everything that we can at the command table to build our capacity to have patients received at our hospitals and our other healthcare facilities.
Okay, but if I look specifically at ICU beds and ventilators, which are clearly, there are clearly limits to those, this scenario is just 7.5% growth rate. Today, it was a 20% jump in new infections from overnight. How concerned should people be that the curve is not being flattened enough and that Ontario could, as these researchers say, run out of ICU beds and ventilators in about 37 days?
I want the people of Ontario to know that we are certainly aware that there are going to be tremendous pressures on our healthcare system and that we are building our capacity in terms of hospital beds, healthcare beds generally, and in ventilators. We've just increased our in-house supply by 300 ventilators. And as we indicated in the briefing yesterday, we are working with auto parts manufacturers, for example, to see if they can retool their equipment in order to produce more ventilators. So we are increasing our capacity both in terms of places for people as well as the equipment that people will need.
Hi, Premier. You mentioned that no one will lose their job if they have to stay home to take care of their kids. But what should healthcare workers do or other essential workers do if they don't have healthcare or they don't have daycare right now or kids in school right now?
Well, first of all, we can't run the system without the healthcare workers, and we'll do whatever it takes to support them in any fashion. Right now, I'm sure they're relying on family members and other friends to take care of their kids. But again, we don't want to have gatherings of 50 kids in a room, be it daycare or at schools. We're really going to have to all stick together, help our neighbors out, obviously help family members out, and pitch in. These are unprecedented times right now, and we need everyone to play their part in helping us out right across this province.
Is that why you decided not to go the route of Quebec and provide emergency childcare?
Again, everything's on the table. We have that on the table. We're working with our minister, our chief medical officer of health, but we're taking nothing off the table. As the minister was saying about ventilators, and there was an article in the Star. Yeah, the Star writes great articles. And there was about, this goes back to World War II measures. We're asking the business community to step up and make a transition on their assembly lines to start producing ventilators. I was on the phone till, God, it was probably 11 o'clock last night, talking to manufacturers, some of the largest manufacturers, not just in Canada of automotive parts, but in the world. I'm just so proud of the people of Ontario for stepping up. I'm so proud of the businesses, the Retail Council, talked to the largest retail companies in the country and in the world that have their Canadian divisions here. They're offering anything and everything to help Ontario get through this, and we appreciate it. But everything's on the table, and we will do whatever it takes to get things moving forward. And the business community is stepping up in a massive way. We're getting calls from all over saying that they'll be able to supply gowns, they'll be able to supply the face masks, they'll be able to gear up for the ventilators. And we're ramping up every single day. And I can't thank them enough. And I can't thank the people of Ontario enough for all of us sticking together. That's the way we're going to get through this.
And Premier, you said it's critical to practice social distancing. So
Yes.
are you considering any sanctions or measures for those who are not doing it properly to punish them?
Well, you know, that's a great question. When I go down the street here or travel anywhere in the city, the streets are empty. People are cooperating, and we can't do this by really, you know, going out there and enforcing it. We need their cooperation. Yes, there's always enforcement if we see a gathering at a bar or a restaurant of 50 people, but that's not being responsible. That's not being a responsible Canadian. And as far as I'm concerned, everyone is stepping up to the plate. And again, I appreciate everyone's cooperation because together we'll get through this.
And I'm sure you're aware there's a number of Canadians stranded in different countries. There's a number of them in Peru, including a group of school kids. Is your government doing anything to help repatriate them? Have you spoken to Trudeau? What are you doing to help bring them back?
So I'm glad you answered that question. I was on the phone with a mother 4 or 5 times last night, had our team immediately call the federal government to get a plane down there. And as I told my team, I don't care if we go bus, boat, airplane, whatever it takes to get those kids back. There's 22 of them. And I was talking to one of the mothers, talking to the headmaster. We had our staff talking to the headmaster of the school. And these kids are coming home. These kids are coming home, and we're arranging a flight. And I got to give a shout out to Air Canada. Thank you, Air Canada, for coordinating this. Thank you, federal government, for helping us out, getting the permits to land. But we're in full communication. I literally just got off the phone with a mother again. I think it's probably our 4th or 5th call. And they're so grateful. But we can't wait on delays for bureaucracy or politicians or anyone to react. We can't wait 2 days, 3 days. We're acting immediately. And again, when I was on the phone last night, it was, I guess, 8, 9 o'clock at night when I had this phone call. And we reacted immediately. And because of that the way we reacted swiftly and decisively, these kids are coming home.
Good afternoon, Premier. I'm just following up on your conference call with the retailers, the CEOs.
Yes.
In the spirit of social distancing, did you get a commitment from them to limit the number of people that are allowed in stores at once and somehow spread out lineups as well?
Well, it's another great question. They're concerned, and it'd be my concern too. We start having people lining up outside, side by side, pushing and shoving. Some of these stores are very large. If we can, this is the theory, and I believe in this theory, if we can stock the shelves and reassure the public that they don't have to be going out and buying every single day, they'll be able to spread out a little more. But their concern is they're going to have lineups, everyone breathing on each other out in the lineups, and they said it would actually be worse. They're making sure that there's proper hand sanitizer, wipes, to wipe down the carts. They're doing 4 or 5 cleanings a day, so I'm told, and we're just going to have to make sure that, again, it goes back to the supply chain, not hoarding. Until people aren't panicking. We go back to this toilet paper issue. The last country in the world that should worry about toilet paper should be Canada. We have more pulp than pretty well any country. We have massive capacity at Irving on the 400, up at Kimberly-Clark and in Huntsville. We have the capacity. I'm just, again, asking the people, begging the people, please do not hoard the toilet paper. There's not a supply issue if we just take a case at a time or a bundle at a time. I've reached out to the hand sanitizers companies, making sure that there's anything that they need from our government to increase capacity. I just literally got off the phone with one of the large ones before I walked in the door. We have calls into the handy wipe companies like a Virox that are over in the 905 that do handy wipes. We're asking companies to make the transition with the distilleries. We have our ECDEV people calling every single distillery, asking if they could put one of their lines with the alcohol and water-based to convert over. As long as they have a proper warning label and they have a bottle, we don't care what bottle it's in. They could use their liquor bottles as long as it's properly labeled, so they won't have to change over. All hands are on deck right now. As I've told the Ontario Provincial Service, it is not business as usual. We cannot wait a day, we can't wait 2 days or a week for an answer. We want answers by minutes and by hours. Everyone is on full alert, and the business community is stepping up in a massive way.
And we're getting increased calls to our newsroom about workers going on vacation outside of Canada, all over the world, returning home and refusing to go into self-isolation and going to work. Does the province have the power, whether it be through the Ministry of Labour or another ministry, to find the employer or the employee? And if so, is that something the province is going to start considering?
People have to self-police themselves. It's common sense. You know, does it come to public shaming by your neighbors or your co-workers? Folks, we're in a critical situation right now. If you're coming back from a holiday, you aren't self-isolating. You're putting the people of Ontario at risk. You're putting your family, your kids, your grandparents, your mothers and fathers at risk. Please follow the guidelines that everyone else is following. Do not go into work. Do not go into public spaces. Do not be selfish and go out. Stay isolated for 2 weeks as we require. We don't have the resources and the police to be knocking on everyone's door and saying, are you staying in? We have a responsibility as residents of this province to make sure we all work together. Thank you.
Question for the Health Minister, please.
Yes.
Minister, I'm just wondering to what extent there are solid lines of communication between the doctors in this province, healthcare system, and doctors in other regions or countries who are bearing the brunt of this, the worst form of this virus, sort of passing along knowledge, best practices, this sort of thing.
There are open lines of communication, certainly with Dr. Williams and his colleagues across the country, and with the Center for Disease Control in the U.S., the World Health Organization. They are all sharing best practices now. This is a time when we all need to come together. If there is something that is working in a certain population, then we need to share that with everyone else, because we are all in this together, not just as Ontarians, but internationally as well. So there are very good lines of communication open.
And just lastly, do we have a sense of what these tests are worth, how much they cost, each test?
Each test, well, there's a myriad of factors. That it's the testing, it's the reagent, it's the work that's involved in reading it. So that would be a collective number that would be involved in that. So it's worth much more than just the test kit itself.
Thank you.
Hearing from Premier, and perhaps you and the Health Minister might want to touch on this. I know that you're a lock them up and throw away the key guy when it comes to justice. You've said that many times,
Yes.
but I'm hearing reports of COVID-19 showing up in jails in Ontario. Multiple cases, I'm told, in local Toronto jails and elsewhere. Complaints from duty counsel, because while jury trials are suspended, others are not. Yeah. Duty counsel saying, look, garbages are being emptied, but desks aren't wiped down. There's very little disinfecting going on. Do we need to start perhaps using technology or increased disinfection while people who are arrested need to make their bail appearances and other reasons for courts to remain open? Are we doing enough to stop the spread among not only prisoners but guards, lawyers, the people that cook for them, everyone else in the system?
Well, talking to the Solicitor General, that falls under her preview for corrections as well. She's been in full communication. We've stressed to the minister how important it is to make sure they have a sanitized area. Even inmates, reason being, inmates are in close proximity to the guards. So it's critical that we disinfect the jails, and also making sure that inmates have proper cleaning products, be it soap, hand sanitizer, because they can transmit it over to the guards. Guards bring it home. So it's absolutely critical. And Brian, I'll be talking to the Solicitor General like I'm talking to all my ministers. We will reinforce that. She understands that. Sylvia Jones does an incredible job. But I've asked all our ministers, I want data. I want to see data, because you can't manage unless you measure. And we'll make sure we get the data coming in as we are right now on everything from the question you just asked me to supplies and healthcare. We need to start measuring. We need to make sure the forecast is properly done. And as this goes up or hopefully flattens, we'll be able to have a good handle on it. But I will make sure that I reinforce that question with the Solicitor General today when we have our cabinet meeting. We have cabinet meetings every single day. We're going to have one today around 4 o'clock, I believe. And throughout the day, I'm in constant communication with all our ministers.
In terms of the impassioned plea you just made for people to stay home,
Yes.
To self-isolate, we've got tens of thousands of snowbirds coming back this week, next week. They've all been told by their insurance company, get home.
Yes.
What do you say to them? They're going to come home, many of them, to empty houses, no groceries, no food, no supplies. They do need to self-isolate, but what's your message to them as they come back mainly from the United States, where this is much more prevalent than it is in Canada?
Yeah, something, first of all, before I answer that question, I want to thank the media. You're playing a massive role in helping us out. And I just want to thank you. We have to rely on loved ones. Now, people that don't have the loved ones, they don't have any family members to drop off groceries at the step of the door or in front of their house or their apartment. We'll make arrangements for food banks. Again, another great company, Cisco, is stepping up to the plate. I know Gateway Groceries, again, for delivery services. They said anything you need to call us. So we will be calling on them and making sure that everyone is fed.
So they should be looking, instead of going out when they get home.
Oh, they need to they need to self-isolate. We don't want anyone that has been on vacation to come back without self-isolating. There just can't be exceptions. They need support. Please reach out to family members, neighbors. If you're living beside a snowbird that you know they're away, because most neighbors keep an eye on each other's house when they're away, do them a favor. Go out, get them groceries, drop them off. But for anyone who doesn't have family members, relatives, neighbors that will do that, we will make sure they get groceries through the food banks. We'll be tapping into the private sector to make sure these people are taken care of.
Premier, is there some mixed messaging going on? Yesterday, the Toronto Medical Officer of Health said, don't even have coffee with your friend. Don't get together with anyone. And yet we're still allowed gatherings of 50 people or less. Should that number come down to smaller gatherings?
Well, I'll pass that over to the Minister of Health. And again, I'll follow the advice of our Chief Medical Officer of Health of Ontario. Good point, Cynthia. Everyone has to be singing off the same song sheet. I agree with that. I'll pass that over to the Minister.
Thank you. It is a very good question, and we are certainly encouraging people to practice social distancing as much as possible, to be at home as much as possible, that having coffee is a great way to connect with people, but we're asking people if you can do it by phone or in another way, please do so, because this is so important to prevent the spread of COVID-19. As the Premier indicated, we have a responsibility to protect our own health, but really to protect the health of everybody around us. It really is a matter of life and death. It is very serious. And so we're asking people to please forego these get-togethers for now. Please contact each other in another way, by phone. It's really very important. So while we say that we don't want to have any gatherings of 50 or more people, the smaller the better, and please stay home and self-isolate as much as possible.
And do you think, Minister, more needs to be done to educate younger people? Yesterday, you revealed that more and more people in their 30s, not in Ontario, but elsewhere, New York, for example, they're on ventilators. They're getting really, really sick. And I think, you know, the initial messaging was around the world that younger people aren't getting it. They're not getting that sick. Do we need to educate younger people? We've seen in Miami how they were all out having a great time. Are they taking it seriously enough? Do we need to do more to educate people that even if they're younger, they could still get sick, or they could make somebody else very sick?
Yes, I think that we need to get the message out more. That's why we are increasing our campaigns in print, radio, television ads are going to be coming out very shortly, really to talk to everyone. And I guess I would say young people in particular, to say that while you might not think that you would be susceptible to COVID-19, you are. It doesn't spare anyone, and that you are also a carrier of COVID-19 in some cases. And so you may be, by not self-isolating, by going out with large groups of people, you are putting yourself at risk, but you may be putting parents at risk, grandparents at risk, other members of the public at risk. We need everybody to be very responsible about this, to recognize that we do have that requirement, really, to look out for each other, and that applies to the entire population. Thank you.
Minister, question for you as well. We've just learned of the second death related to COVID-19 here in Ontario in Halton Region. You're aware of this? It just came out moments ago.
We're still waiting for confirmation from the coroner's office with respect to the first person who passed away. I don't have any comment to make with respect to any second person at this point.
Okay. I just want to let you know, Halton Region Public Health confirms it. The second COVID-19 related death in Ontario.
I'll still have to check on the details of that information, because I know there was an announcement that the first person passed away because of COVID. That has not been confirmed yet with the coroner's office, and I need to make sure that that can be confirmed.
My second question is, we are hearing, well, as you know, the self-assessment online, and when you call telehealth, before you go to an assessment center, the real concern is if you've traveled anywhere outside the country, specifically in the last 14 days. But now, the medical officer of health here in Toronto saying yesterday that the City of Toronto is investigating 11 cases of community spread. We are hearing potentially in a few days that recent travel will not be a requirement anymore for testing. Is that something you plan to announce soon?
Well, as Dr. Williams has indicated on several occasions, we are seeing a spread in the community, that there is evidence that it is in the community. Whether he is prepared to call that community spread or not is really up to Dr. Williams to decide, and I'm sure that he will provide you with that information this afternoon.
For the Premier or for Minister Elliott, the ventilator updates is exciting. When you talk about automakers who are stepping up to the plate to potentially change it up so they can build the ventilators, which automakers are these? Is it the Oakville plant or is it the GM plant in St. Catharines? Do we know?
Martin Rea is offered to, if we get the design, that's what we need. We need the designs, and they'll be able to put something together. They said they had 400 people ready to move forward. Spoke to Don White over at Magnitude, the CEO. He was up late last night. We were discussing the largest automotive part manufacturer in the world. His words were, Doug, we will do whatever it takes to pitch in and help. These are the stories that the people need to hear about businesses around Ontario. Had a call from our Minister Urick saying there's a company in his riding that is prepared and ready to start making ventilators, and everyone needs to step up. We have the capacity. There's no region, in my opinion, after traveling around Ontario for the last 2 years, there's no region in North America that is more diverse. We can build anything in Ontario, absolutely anything. We have the resources that other jurisdictions in North America just don't have, no matter if it's natural resources or manufacturing capabilities. Pharma, we have one of the largest pharma industries in North America. I know Toronto's a hub, New Jersey's a hub, Puerto Rico's a hub, but we have the pharma industry on full alert, helping us out any way they can. So I just a message to the businesses, keep your ideas coming. If you have an idea, there's no such thing of a bad idea. I understand that my Minister of Economic Development is going over to Canada Goose. They have stores, as you know, across the country. They have a lot of sewing machines over there. Let's convert them over making medical gowns. And again, any company that has sewing machines, we need to hear from them. Some might work, some might not work, but it doesn't hurt to try. It's all hands on deck right now.
Is there, I guess it seems super early, but is there a time frame for that to actually happen with the automakers?
Well, again, I was on the phone call late last night. Our team is all over this in full communication, making sure that we can get a hold of the design and drawings and make sure we have the parts. But there's no one, in my opinion, that understands manufacturing better than the two companies I mentioned. They're saying we will provide the staff at no cost, our expertise at no cost. As Don was saying, we may not be the right company, maybe someone else, but we have the resources to support them. And this is companies pulling together and making sure that they're doing the right thing for the people of Ontario and Canada. We can't rely on importing these ventilators from over in Asia or other places around the world. We have the people, we have the capacity, and we're gonna start manufacturing here in Ontario.
Question for the Minister of Health. We're getting reports that as much as assessment centres in Toronto and the GTA have all the supplies that they need. On Monday, at least, an assessment centre in London said they didn't have the supplies they needed to conduct tests. What is the government doing in order to ensure that this isn't just like a province-wide level of sufficiency, that we have sufficient resources throughout the regions?
Yes, we have been working cooperatively with the federal government, who's agreed to help us procure supplies as we need them. And we have just been advised that they are delivering to us 50,000 more test kits with reagent so that we will be able to keep our assessment centers supplied.
And for the Ministry of Finance, I'm hearing a report that LCBO workers are concerned about being kept on the job, that they don't feel like it's a particularly safe time to be working in what is basically a retail space. Has there been any consideration given to further shutdowns of the LCBO?
So the reduction in hours was in part in response to that. I've been in touch with the CEO as well with Smokey Thomas, the head of the union that represents those workers, to make sure that we're putting the health and safety of the workers at the forefront. So there's active discussions, as there are, and as the Premier mentioned, I think all of the retailers in Ontario appreciate the vital role that they play right now. And so the recent reduction of hours was to make sure that there was more time for making sure that the stores were cleaned. And we're going to continue to work with labor and management to make sure that that we keep it that way.
But, and I'm sorry, just no further reductions in hours are currently in the plan?
Yeah, not at this time, but as we've said, we will have to keep assessing things. But I said throughout the supply chain, and particularly whether it's grocers or pharmacists or others that are supplying the daily needs of people, they are vital partners, and we have to make sure that that they get what we need from our government, and we'll do that.
Okay, we'll go to the phone line. First question.
Your question comes from Allison Jones of Canadian Press. Please go ahead.
Hi, I think this question is probably best posed to Minister Elliott. I'm wondering if you're considering at the moment waiving the 3-month waiting period for OHIP for certain people who are new to the province, like new immigrants, migrant workers, et cetera?
Yes, we are. We know that there are many people who are returning to Canada who may have been away for longer periods of time. And so, yes, we are looking to change the regulation for a period of time to allow for the waiver of that 3-month period so that people will be able to get health care immediately if they need it.
Now, would that just apply to people who are returning to Canada, or would it also apply to people who are new to Canada?
That would be for people who are returning to Canada, but we'll also make sure that people who are new to Canada, should they need health care, will also receive it.
Okay, this will be the last question. Next question.
Next question comes from Rob Ferguson of Toronto Star. Please go ahead.
Also for Minister Elliott, please. I'm a bit confused on the ventilator situation. Yesterday you said you've ordered 300 new ones, and today it sounded like they're actually here. So where are they, and how many ventilators are there in the system already, so that we can calculate what percentage increase this is in ventilators? Because, you know, there's a lot of warnings, as Mike Crawley indicated earlier in his question about a surge.
Yes, the 300 ventilators are here. We also had an extra over 200 ventilators in this system that were available for excess capacity, in addition to ones that are already in hospitals. So we have a good supply now, but we're looking to increase it, of course, should we need increased capacity, hence the discussions that the Premier and others have had with the auto parts manufacturers.
Thank you, but do you have a number on how many are actually in the hospitals now?
We could get that information for you, but suffice to say we have well over 500 in excess over and above what's in the hospitals, but we can get you that number.
Okay, thank you very much.
Okay, thank you, everybody.
Okay. I was just going to make one more shout out. I want to give a shout out to the labor leaders. The labor leaders have been absolutely phenomenal, stepping up to the plate, private and public sector labor leaders. As I know, the Minister of Finance mentioned Smokey Thomas. Smokey Thomas has been an absolute champion. Jerry Diaz, the head of Leuna, Joe Massinelli, offering up his masks, his ventilators, masks to the public. And I just can't say enough how you've stepped up to the plate, and we're forever grateful, and thank you for helping the people of Ontario. Thank you.